July 20th, 2023 meeting of the Fitch-Rona EMS Commission.
Roll call. Roberts.
Here.
Hilla.
Here.
Johnson.
Here.
Cronin.
Present.
Kaiser McHenry. Lonsdorf.
Here.
Wheeler.
Here.
Luganbo.
Here.
Chief Anderson.
Here.
Okay.
Any,
There you go.
any public comment tonight?
I got nothing.
No public comment. Moving to the next item, review and approve the meeting minutes from June 15th, 2023, which is handed out in the packet. If there's any comments or questions or revisions? Do I have a motion to approve the minutes?
I have a motion.
I'll second Sue's.
All in favor, signify by saying aye.
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 All opposed, signify by saying nay. The motion passes. The minutes are approved. Chief's report.
Got it. Thanks. I have it up on the screen there for you to look at. It did get sent out. It's the usual stuff that you see there. Still running above average for the year. So still looking at just over 5,000 calls for the year. Other number to note there is year to date, our mutual aid request as we look at all those other agencies that are coming into our territory, and that was 16 times, so year to date. So it's happened about 2 to 3 times a month where all of our resources are out, and we require our neighbors to come on in and help us out. We actually just completed our consortium training. It's Dr. Kim from UW Hospital came in and did some pediatric case reviews with us, and kind of went over again our IV pumps that we got with our Flex grant and kind of the applicability for pediatrics. So did a pretty good presentation, some really good case reviews for us, and then we wrote those up, and our staff then will kind of go through those and set those up to become more comfortable with those. So that's our department training. Have started doing some more community events out there, back in full force, kind of post-COVID. Rest of that information you can see listed there as far as our data. As far as the financials go, you're going to see again the 180 days got bumped up one more time. I did want to share with you, so Brad, we use Three Rivers Billing Company. Brad has been our representative there. And Brad actually passed away about 2 weeks ago, very unexpectedly. So it is a family business. So we've reached out to his wife. Going to give her a couple weeks to kind of re-grasp and kind of group to see what's going on there. And then we will chat with her and come up with a plan. I did pull all of I get the monthly report that all this is on, so there's kind of a big chunk of calls that are about 6 months from last year that are really those 180 days. So I'll connect with her and find out what the solution is going to be with that and how do we prevent this from moving forward. But I kind of wanted to give her a little bit of time to kind of regroup. It was unexpected. It was unexpected, so they're trying to kind of collect that back together. As far as all the rest of the cash on hand, those are the numbers that are there. Michelle, I guess, have we received second half of the year checks?
Yeah.
When we have invoiced them?
Yes. We
Okay.
invoiced them in June.
Okay. So towards the end of July here, I'll let you know. I'll reach out to the representatives if those kind of continue to be delayed, but we'll be looking for the second half of our funding from the municipalities here pretty quick. The assigned balances, lots of lines got nixed this month as we have spent down. We finally actually got the equipment that we ordered 6-8 months ago. So that was our ARPA funds. That was last year's, most of last year's EPIC grant, as well as the last part of our Flex grant funding. So at the bottom, when I had kind of the updates in there, we ordered 2 new ambulance cots. One of those will go, both of those will go actually into the new ambulances that are on order. But some new features, they move a little bit quicker. The mechanics on them are actually significantly better than the cots we have, as well as one of the months here we got the power stair chairs. That was actually our EPIC grant from last year. So historically, Our chairs actually have treads on them. So if we have patients top floor, bottom floor, got to figure out how to get them up or down the stairs. Most of the time, we don't want to be carrying cots up and down the stairs. So we got to carry the patients up there, and it's much more ergonomically, much safer to put them in a chair. Going down is not horrible. We had tread in the past, and they kind of lean back, and the tread kind of helped them down, but it doesn't work with gravity super well. So we've always had to carry them up. So this is actually a Fitch-Rona product. There's a Milwaukee battery in there, and they now actually power up. So we still got to move patients onto the chairs, but we can actually power them up the stairs and not have to actually carry them upstairs anymore. So has been a pretty good product for us to have. Again, going to help out with a lot of the employee safety. But you'll see those assigned balance funds now have significantly decreased, as well as a lot of the FAP funds as we caught up paying for the training and some of that equipment as well.
Question,
Christmas early.
with the batteries on those chairs, is there like a set number of flights it can climb up or time limit?
She
or-
did 22 flights.
Okay,
So
significant.
pretty significant. We got nothing so far yet in our district that'll do that. They have a battery and they check them every morning and rotate them out. But yeah, it's listed for 22 flights.
Okay.
And then Sue, did you have a question?
No, with all these deliveries, finally, I said Christmas came early.
They all actually showed up in about the same 2 weeks. The trucking companies were busy, and then our sales reps came out and did the training for us. So yeah, it was lots of going into the summer with lots of new presents and keeping everybody safe. So their assigned balance or our WISC account is listed there. July tends to be a significant milestone for us as we started expanding rigs. So Dale Dow, who's one of our full-timers, he actually hit 25 years this year. That was a part of his, he did 1 year, a couple of years as a volunteer before he came full-time, but so 25 years total. Gary and Andrew, both a significant amount of time, and then Nicole, Kat, Justin, Kelly, and Ryan were actually all of those people who came on when we added that third ambulance in July 2019. So those are all big anniversaries for them. Then there's the updates. I found out last week we were actually awarded our EPIC grant. So we will actually be purchasing point-of-care ultrasound. That's a pretty new thing totally for paramedics. I've reached out to the state of Wisconsin. It's out in their scope of practice. They connected me with only 2 other services in the state that, at least at this point, that are using it. It's restricted at this point in its use in the pre-hospital environment as we're doing cardiac resuscitation, especially on bigger patients or challenging patients. It can be difficult to find pulses on those patients when we're trying to do some cardiac arrest resuscitation. Ultrasound actually allows us to take a look and see what the heart's actually doing. So these patients may actually have pulses or before we're looking at continuing resuscitation or adding fluid. That's right now what we're limited to, but especially with partnering up with UW, the potential for field ultrasound is huge. So I just found that out last week, meeting with kind of a team from UW, incorporating them into our training and continuing education, because it's not like a skill that you just kind of learn and let it go. So significant training, significant onboarding, and then pretty significant continuing education for it. So that's another kind of really exciting thing for us that's going to help us with some patient care. And then just the shout outs I started last month. Christy, our Lieutenant Schnabel, did a shout out to the Fitchburg Engine 3 crew. We had a couple of weekends out there that were significantly busy. So just she is actually shouting out to the Fitchburg crew. And then we had a structure fire out in Verona on a pretty significantly warm afternoon. Chief out there wanted to give a shout out to our crews, and that was Gary, Jeremy, Justin, and Molly for the really nice job they did in supporting the rehab department in that multiple fire. And then Dr. Spigner, who's actually kind of part of the UW team who works with us, had a pretty significant or a high acuity call, put it in quotes there, right? A high level of expertise and excellent decision making for a patient who is actually a cardiac arrest survivor. So they recognized that. And then I think I chopped off the second line there, but that was Molly and No, that was actually another one. And then I chopped off the one, Dr. Lonsdorf actually reached out, and that was Molly and Sarah, who had a call out at the dog park. I don't know, I can do a quick summary unless you want to share what you saw. It's not often our commissioners get to witness firsthand what they're supporting.
Yeah, the dog park was closed that day for a work party. One of the women who was working, it was a hot day. She took a break to sit on a bench. And as she got up from the bench, she missed her step and badly fractured her ankle. And then passed out from the pain, and I imagine a little bit of dehydration too. So the ambulance was called. They had to drive into the park and negotiate some of the hiking trails to get to the where she was sitting. And that's about when I arrived. I was working on a different crew, but when I saw the ambulance and the fire truck coming, I naturally wanted to go see what was up. But they didn't need my help at all. They were right on top of it, loaded her into the ambulance and took off with her. So nice work.
Yeah, thank you. So that was another shout out that's listed. I again chopped it off in the bottom of the PDF here. I'll make sure that gets included when I send this out to the city administrators. But thanks for that feedback. It's been really great. I like to recognize people for what they do. If there's any questions on that part of the report, otherwise I'll just throw the financials up quick. Let me negotiate where my share screen is. There we go. So the other part, yep, this was emailed out as well. So this is kind of that in-house operating budget where we are at to date, 49% through the year. Run income is still above where we anticipated it to be. So collection rates are there. I think I brought it up last month. One of the things that we did learn with shared revenue, though it's complicated and I don't know that anybody really knows how it's going to pan out to anything. What I'm finding out, none of that is going to, sounds like, come directly to EMS. It will go to the municipalities kind of with that tag in there to be used for protective services or public safety. But one of the things I did read in there was during COVID, there was an increase in Medicare and medical assistance reimbursement for EMS agencies. That did come out of the shared revenue part that I saw in there, and that the hopes that it actually should be replaced by a federal program. But it sounds like that wasn't a huge, that was really going to happen. So as we have our run income here higher than expected, I guess the hope is what I'm seeing is that I'm trusting that funding is still going to continue and be replaced by a federal program and not the state program. Otherwise, everything else is right where we would plan for it to be. I know there's the usual, the scheduled overtime is over budget and the unscheduled is under budget. As long as those two kind of average to a nice where we're at in the year, it's just really how it gets put into a spreadsheet. But so we're actually still sitting okay with overtime. My guess is we probably will be a little higher in overtime towards the end of the year, just based on the FMLA people, the 2 employees with the FMLA leave that I had mentioned the last couple of months. Otherwise, just the usual. We are over in our legal fees as well, with just the MOUs and this. That's not negotiations. Those are its own fund. So it's just kind of the MOUs and the kind of addressing some of the issues we have been since the beginning of the year. As I mentioned, the budget summary for next year, we did up that for next year with the amount of time we've been using Leslie this year. You got this? Any questions on that?
Any question for the chief? Seeing none. Moving to the next section for the subcommittees or the committees. Personnel committee did not meet. Did finance committee meet? Anything to report? Nope.
No meeting.
So neither committee met. Okay, moving on to agenda item 7, approval of resolution 2023-2 GASB fund balance.
So this is the thing that you approve as soon as we get the information from the audit. So all it does is take and every month just defines our, defines what our assigned funds are, fund balances are. So that's where it is. The inventory prepaid expenses, those are determined in the audit. And then exactly what you saw on the chief's report there, the FAP funds, the sick leave liability, and the contract negotiations. It just defines those as assigned funds. So just obeying the law. Just needs an approval.
Any questions for the chief regarding approval of resolution 2023-2? Seeing none, do I have a motion to approve?
I'll make a motion to approve.
Do we have a second?
I'll second.
All in favor signify by saying aye.
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 All opposed? The motion passes. Next item, review and approval of accounts payable checks authorized by the chief. They were provided in the pre-meeting preparation packet. Does anybody have any questions for the chief regarding the? Yeah, if you haven't seen them, we have a paper copy here. You can take a look. No questions, then is there a motion to approve the accounts payable checks?
I'll make a motion to approve the accounts payable checks.
Is there a second?
In second.
All in favor signify by saying aye.
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 Anyone opposed? Motion passes. Next is the discussion and possible action on policy update, dress, appearance, and personal hygiene.
So policy for you to review. You did get a red line copy of it, so that I just took the red lines off of here so that I could get a clean signature on it. Biggest changes that were on there that were highlighted. It was just clarifying. We didn't really have a definition of what the uniform was. So all it did was say that the items that are in the collective bargaining agreement are truly what the uniform is. So essentially, leggings, you can't wear leggings to work, right? They're not in the collective bargaining agreement. I know it seems kind of silly, but it's housekeeping rules. So it refers to the collective bargaining agreement. So every time we update that, we don't have to re-update the policy. Other thing it does is we have had essentially a memorandum from myself that is years ago about shorts. Chief Merlin before me, he kind of was based on temperature and days and all this stuff. It just got, what happens when it's 90 degrees at noon and 60 degrees at 6 a.m. I just changed it to a date. So that was actually just a memorandum I put out for staff 4 or 5 years ago. Now, that was the only place it existed. So now it's actually in policy that's in there that provides some dates based on so when they can wear shorts with, again, the requirement that if it's any vehicle crash, significant fire rescue operations, they all have turnout gear and that shall be worn. They can't wear shorts on those when those things occur. Other updates that are on there is, as we have now the PAPRs, the positive air purifying respirators, the hoods with the filters that we got during COVID, that changed things with facial hair. Prior to that, they had to have facial hair. If they had facial hair, they still had to be able to wear an N95 mask. Now the world is very familiar with N95 masks. So because we have those PAPRs, we still do fit testing for people so that they know what size and what type of mask to wear. But if they choose not to be able to if they don't want to shave or they can't get that fit, we do provide equipment to them. One thing I did actually update after talking with some staff is number 5 on there that was not sent to you, if you wanted to discuss it or not. So the original policy said tattoos shall be covered. So just a little bit of kind of internet research on there, what HR says, kind of what our neighboring services do. I changed this so that tattoos, it just says that tattoos that are demeaning, contain profanity, or that should actually say do not support. So when we make the motion to approve it, we need to make it with the correction. But that do not support a safe or inclusive environment shall be covered. Essentially, we can't prohibit employees from having I mean, we can, but you can't really prohibit employees from having tattoos. But if they would meet those criteria, then we can require that they be covered. And that was kind of a lot of the HR documents I got, that was the case. Because the previous said that tattoos shall be covered, which means people are wearing long sleeves who have sleeve tattoos. So I think that covers that very well. And then the last one was actually just changing the language in there that said, I think it said EMTs, and now it just says employees and volunteers as far as who the policy applies to.
The tattoo one is, you said you received HR guidance on that. That's kind of like a
Yes, kind of. There's
current standard right now.
Yeah, it allows we can put as much or as little restrictiveness as we want on it. It still kind of goes back to, well, who determines what is what. I don't think we have a problem with that. So it actually, that language updates to what we're currently doing. But yeah, that's kind of the generic language that is suggested.
Are there any questions for the chief regarding this policy or for anyone else?
None.
All right, do I have a motion to approve this policy
I move approval.
with the editorial change,
the
edit
not.
change to not?
I move approval with the editorial change.
Thank you. Is there a second?
I'll second.
All in favor signify by saying aye.
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 All opposed signify by saying nay. The motion passes. Let's see, so we need a motion to move to closed session.
We need to do the budget first.
Oh, sorry, I jumped. All right, so the next agenda item is presentation and action on the 2024 operational budget. If I have my memories correct, so last month we discussed it in detail. The chief presented. This was the month to kind of think about it, discuss it, ask questions. The outcome of this meeting is really, if there's any questions, is going to be a motion to approve you moving the budget, presenting the budget to the municipalities.
That is correct.
That's why we're going to do this.
Followed that correctly.
Okay, now, and then, so that'll be lead my question. So now, next step, you present to municipalities, then it comes back for like a, nope, not coming back here?
Providing it passes the municipalities, it is a done deal. If any of the 3 municipalities have issues with it, then it comes back here.
Okay. And you're the owner of this process, right?
Yes.
You move it through,
Correct.
questions come back to you?
Yep.
Okay. All right. Were there, I guess another question, sorry, were there significant changes from last month?
2 changes, and they're highlighted in red. So we actually, one of them was actually just getting real numbers. So the WRS system, the state retirement system, for 2024 contributions came in. What that increase was for next year. So for protective services, it actually went up by 1%. Most of the WRS only went up. The rest of it went up 0.1%. For protective services, it went up 1%. So it's a pretty significant increase in our retirement contribution budget line. And that's something we can't control. That is a state requirement. The only other thing that I added that we can control, and I actually waffled about putting it in last month or when I presented it to you the first time, is I did put additionally, so it'll be a single year cost next year for $11,000 to purchase replacement key Knox boxes, Knox key boxes. So what a Knox box is, if you're unfamiliar with it, public buildings, municipal buildings, most apartment buildings. If you've ever seen a little square box with a little red tag on it on the outside of it, that sort of, I know what it is. It looks like a key box. So that's called a Knox box. Knox is actually a brand, but they own the product. So the fire apparatus and actually all of our ambulances as well actually have a key to get into that box. In that box then is actually a key to get into that building, and most buildings then will let us get into the building from in that building. So essentially the example would be after hours, if we get called to an apartment complex and say somebody fell on the floor and is unable to get up and answer the door or buzz us in, between us or the fire department, we can actually get into that box get the key out of there, get in the building, and actually get into that apartment building without the resident ever having to come in. On the fire side of things, right, if Walgreens is on fire, they can actually get into Walgreens by opening that door. So we have 2 Knox boxes because those Knox boxes are essentially proprietary to each organization. So Fitchburg has, and it's called a core, is the key that's in there. So all the Knox boxes in the city of Fitchburg are cored the same with the same key. And this is why and same thing in Verona. So this is actually why they're kept in this Knox box with a key code, because access to that key gets you to every one of those boxes. We keep it very tight control on those. So we actually have 2 of them, one for each city that we participate in. The current boxes we have, they actually stopped producing them a couple of years ago. It's called it's a 3B. They stopped making them. We've been able to, at least the last 2 ambulances, kind of wheel and deal people who were replacing theirs and get them and put them into our trucks. So we still all have the same system, though they're not making them, and we can still probably acquire some of them from some roundabout means. The bigger challenge we have is the software. I physically have to go to each one of those boxes. So 5 ambulances with 2 boxes each, 10 boxes. And every time we have to add someone or take someone away, plug my computer into that box and update it. The software after this year is actually no longer supported. So one of the challenges I have, and though I was in there just a month, added a new employee in there, went to every box, plugged them in. I went in today and the software is actually all corrupt again. So this is actually, last year I had to do the same thing, uninstall it, reinstall it, and re-put everybody in because the software is going corrupt as everybody's moving over to the new platform. All of our medication vaults on the ambulances and in the stations are med vaults that are also Knox box. Knox creates them as well. We made that conversion 2 years ago. So now everything is web-based. I add it on my desk. I add one person, I hit the button, and every 10 minutes those things sync. So every vault we have syncs with the click of a button. Adding these boxes in there will do the same thing with those key boxes. So now with one click of a button, we'll update every medication vault and every key box that we have specific to both municipalities. About $11,000 to replace all of the pro to this is actually the boxes they have now have 2 keys in each box, and we can core each one of those to each municipality. So I actually only need to buy 5 boxes. Well, I think I have budgeted for 6 boxes for the ambulance for next year. So we only need to buy 6 boxes, not 12 boxes. So I put those in here. If it's something you would prefer to see come out, we can try to find other funding. I said I waffled about even putting it in until the program went corrupt again. So I figured for the cost of $11,000, it's a really efficient way to of some time management. That is the only thing that changed from what I presented to you last month. If there's any questions on that, otherwise let me throw up what it did. So between that increase, let me share it, sorry. So between the increase in the $11,000 for the Knox boxes and the increase, I remember that 1% on top of all of those salaries increased our overall budget to that. Reminding you again that this is what I'll send to the municipalities tomorrow or Monday so that they at least kind of have an idea what this looks like. All of this will change on August 1st when equalized value comes out. We can look historically what those percentages are, but if nothing changed with equalized value or everybody went up or down the same amount, that's what you would see.
Can you scroll down on the share?
The percentages?
Yeah, like in expenses. There's more lines than that, right?
Yes. I figured this was really just the number you
Oh,
wanted to see was on top there, that this is ultimately what we'll be asking the municipalities for.
Oh, got it. Okay. Are there any questions regarding the 2024 operating budget proposal.
I mean, I guess kind of the usual, the big thing is the salaries and wages, with the, I mean, the other thing to change, the reminder that there is a deputy chief's position in here. Things that can really be changed is the estimated cost of that second deputy chief's position. And then, so that's under the personnel. So, I mean, that went up 8.6%. 21% of that is insurance and 11% of that is benefits. So there's not a lot we can do with this line short of the deputy chief's position, which is about $120,000. So we do have that to play with. And then down here, this is really those operational costs that I can play with a little bit, but I was able to bring that down 4.4% from last year. So we don't have a ton of wiggle room with the exception of, again, that $11,000 and the deputy chief's position. I don't know if anybody chatted with their municipalities prior to last month. They are aware that I'm asking for it. I have done the position justifications for Fitchburg. It's not due for another couple of weeks because of the staffing study. And I have brought it up to the city of Verona as well. So they've gotten those documents that I'll be asking for it. I guess that would be the one. If this group is okay with it, I'll proceed forward in asking for it and then just come back and report to you how yes or no that is supported. I don't know if Jim, you have got any input from the city side or Kate?
Not yet.
Not yet.
Like you said, waiting for that staffing study to come
Okay.
out.
Yeah, we have not either.
Okay. I know we're always kind of a month ahead of this because then Fitchburg, then Verona, and it kind of just trickles down from there. But if you're okay with it leaving in for now and letting the process play out, this is what I have for you.
I'm fine with letting it play out.
I am as well.
Same.
Okay. Any further discussion, questions, comments about
Yeah.
the 2024 operational budget?
I have one question. Patrick, what is driving a 23% increase in oil, fuel, and lube? I see it jumps up about 8,000.
It was historically the price of fuel going up last year, almost $1 a gallon, and the other part of that is this is estimating adding a fourth ambulance next year. So the call volume has increased miles plus the cost of fuel. It's pretty significant. I did go back and actually double check it because that's $7,000 was a lot to go up. Also included there is every oil change. So by the time, and so our frontline ambulance is going for oil changes they put on about 5,000 miles about every 3 months. So I think if I do my math there, plus 2 vehicles, we get about 18 oil changes a year, plus fuel. It's an increase of about $8,000.
Got it, thanks.
Yep. For your information, I mean, and partnered with you, we are talking, and it's just kind of come to a halt just because of budget time, of the potential for using Fitchburg Public Works for our oil changes. I don't know what the cost savings would be other than it supports kind of keeping it in-house, I guess, is actually supporting we would still end up having to pay for them. We don't get them for free. But it would support actually personnel in Fitchburg at Public Works to do our oil changes. My guess is it would reduce that cost. So it's just a matter of still trying to get it figured out.
Patrick, Dave Lonsdorf question. The health and dental insurance went up quite a bit too. It's 21%. I think part of that's because of hiring the new deputy chief, who you said had a family or something. But some of that is like a 12 or 15% increase in the insurance itself.
So we have historically planned of estimated an 8%. We always estimate an 8% increase in health and a 4% increase in dental. And then, yes, a new deputy chief, because we don't know what that person will come with. So we just have to estimate that person will come and require a family plan. And then with the two, with Casey leaving and going to the city of Madison, he went from a single to the person who was hired to fill his spot requires family. And then the hire we have for the person who's out on extended FMLA, there's a kind of a thing there about, I can explain to you how that's going to have to work as well, but that person also is coming in as family. So there was a couple of pretty significant increases there.
All right. Every organization I'm on the board of, which is several, has a similar, 8 to 10% rise in their health insurance. Do you ever give feedback to the health insurance company or pushback, I guess, about why they raise their rates more than everybody else does?
We haven't. I guess I always figured because we're part of that system. But no, we haven't said. Next year will be one of the years that we actually have to need to dig into that as well and kind of reevaluate the program that we belong in. We have the ability to shop on through our essentially our broker to make sure we're getting the best deal. And it's probably been a couple of years since we've done that, but yeah, we have not. We plan.
Good idea.
Yeah, we plan 8%. I think only one year, in the years I've been doing this, I think only one of those years it actually went up the entire 8%. It tends to come in a little less than that, but I think we plan 4% for dental, and I think it's been all over the board with that, higher and lower as well.
Okay. Thank you.
Any other questions, comments? So is there a motion to approve the 2024 operational budget? And to be clear, you're approving that the chief will be presenting this budget to the municipalities. Is there a motion to approve that act?
I'll move to approve the budget.
Is there a second?
I'll second.
All in favor signify by saying aye. Aye.
Aye.
All opposed signify by saying nay. The motion passes. Good to go. All right, next agenda item, you have to remind me of protocol, I think we need a motion to move to closed session to discuss all that stuff. Yeah, so to be clear, I need a motion to move to closed session and then read everything after the period in closed session.
I'll be glad to make the motion and try to read all this.
Please.
I make a motion to move to closed session pursuant to 19.85 parentheses 1 parentheses E. Deliberating or negotiating the purchasing of public property, the investing of public funds, or conducting other specified public business whenever competitive or bargaining reasons require a closed session. Review MOU with L311, comp time for short notice shift work.
Is there a second to this motion?
I'll second.
All in favor signify by saying aye.
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 All opposed signify by saying nay. Motion passes. We'll move to closed session. On agenda item 13, discussion, possible action regarding issues discussed in closed section. And the topics discussed in closed session, the decision is to take no action, and the MOU will sunset at the end of July. Moving on to agenda item 14, other business. Anybody have anything we missed? Anything we want to bring up?
David, we talked earlier, is there any movement on an additional representative from the town of Verona, a citizen representative?
No, and I'll remind myself to talk to Chair Geller about this. There's several other committees that haven't been filled either, so I'm not sure what the holdup is.
Okay.
All right, then is there a motion to adjourn the meeting?
I move we adjourn.
Is there a second?
I second.
All in favor signify by saying aye.
Aye.
All opposed signify by saying nay. Motion passes, meeting adjourned.